Welcome back to this episode on health financing, or some of us like to call it the simple guide to universal health coverage financing. But the concepts we are talking about here are not just for the health sector. These can be used by any government and some private sector entities to see how best to get into financing some of their projects. Today's episode is going to focus quite a bit on the proven strategies for financing the health sector. I'm first going to lay out the six strategies and then spend at least six different episodes working on explaining each. One of the first strategies we said is enhancing fiscal space. This is the budgetary room that the government has to spend, the amount of budget the government can spend without affecting the other sectors. So, if the government spends X on X or X amount on the health sector, it is not going to distort how much it has on Y sector, which is also important on the economy. The second one would be to develop sustainable systems for financing healthcare. Now, these systems are usually, most countries went for levies earlier on, such as the health levy, health fund, and then some of these direct taxes. But as you'll see in some of our discussions, studies are showing that one of the most sustainable way of financing the health sector is through public health insurance. So this is one of the, let's say, strategies which we'll really take a deep dive into in this series and in the other series. The third one is to use the money that we have already well and to allocate it to the right sectors, to allocate it to the right interventions that will achieve the highest impact and cover the most people. The fourth one is what we like to call public, private, or civil society partnerships. These and other innovative mechanisms such as health impact bonds. We are now delving into decentralized finance, non-fungible tokens, and all that. So we'll have an entire episode on that. The fifth would be to make sure that the person or entity or organization raising these funds is actually efficient, efficacious, let's call it that, can actually manage these funds and can raise these funds in a way that the ratio of money raised to the amount of money spent raising it is as high as possible, meaning that the amount of money spent raising money should be as low as possible. And the fifth, we'll talk about some of the other sectors that are crucial in working with your sector, such as the governance, justice, law, and order sectors, information and communication technology, financial sector, mining. These are sectors that can be crucial, infrastructure. Yeah, these are sectors that can be crucial in raising funds for your sector, especially for the health sector, if you collaborate with them. You know, you can run around passing strategy after strategy, uh, camp at the finance minister or treasury secretary's office for months and get what you want. But sometimes a mere change in law, for example, from voluntary to mandatory health insurance enrollment and compulsory government contributions, actually goes a much longer way in getting your money issues sorted. So today we are going to look at these one of these six, and we are going to jump much deeper into the issue of fiscal space. We are going to define what fiscal space is, and then look at the different components: the tax component, debt component, the macroeconomic management component, and then see how you can discuss your issues better with Treasury and get some more progressively increased revenue for your health sector. Thank you, and please join us for the purely financial portion and macroeconomic portion of our discussions in the next episodes. Thanks so much.